cardiovascular. You're on cardiac there, yeah, perfect, and clicked.
In the west of Ireland, the University of Galway is partnering with the Galway University Hospital in cutting-edge training that will have long-term benefits for patients in trauma care.
The purpose of the simulation is to support what they do in clinical practice. So they have an opportunity to practice and rehearse, and they have an opportunity to see and do things that they could never have with a real patient because they just wouldn't be allowed to do certain skills and to see certain emergencies or be involved or be immersed.
The simulations that we get to do in our clinical years of medicine really help to our learning, and they let us embed ourselves in real life scenarios that we will encounter as interns and as doctors, and help prepare us for the sometimes scary patient encounters we might get.
Having simulation on this scale in an undergraduate program is not normal in Ireland. And having your simulation facility on a clinical site and in a university is a real strength for us, and we're the only place that have it.
Now, do you want me to come over? You have to pull that really, really hard.
Ella Murphy is leading the latest healthcare simulation exercise.
The way we run it is we do take people who are working on shift and we take them in for training. So you come in to work. We often run this first thing in the morning, so you haven't started your actual clinical role yet. You come in, do the simulation, and then go straight back to work. You have a lot of high spec equipment, and you can really create a high fidelity. So what that means is a real environment. So whether it's touching a patient and they can actually move, or whether it's that you can hear a patient when you listen to their heart, or they can even smell things or see what we call moulage, so fake burns or fake injuries, that really makes people engage in the role and feel like it's real. Do everything you would normally. We'll tell you if there's something you can't do, so just go ahead and do it. So, you ready? Any questions? Right. So our patient has arrived.
As the team get to work, another layer of realism is added.
Today my role was actually the voice of the mannequin, to make the mannequin back to life.
Sorry, sir. Any pain in your back?
So you've seen me screaming and kind of moaning in pain. Participants go in, they can be a little bit quiet or a little bit nervous going into the room, and the voice of the patient can actually bring them back into the scenario and actually get the scenario going.
So the scenario that we were facing was a young man in a road traffic accident that his car actually plunged into the water.
He ended up having multiple injuries from his head, his chest, his abdomen, his pelvis and his legs.
He was hypothermic, which makes things very complicated to manage.
Super. We have air entry on both sides in our lungs. We have a wound to our right side of our chest. We have clearly got an open fracture to our right femur. Okay, it's very stressful to be in a simulation, so you know every time we do it you don't know what is about to happen in it.
I don't feel a pulse.
Abdul, can we get the defib please? And Connor, could you start CPR please? Some pads on this gentleman. They're very realistic and they allow us to, I suppose, practice a lot of skills that some we do very often and we do every day, and then other skills that we don't get to do very often but are very important, that when someone comes that they need us to do a certain procedure on them. These things can happen and do happen to people in real life, and they're things that we want to be ready for them. I love working in the emergency department. I love the chaos. I love everything about it. The fact that you don't know what's coming in the door.
I need to keep an eye on what the people in the room are doing to the patient or the mannequin, and judging on what they do, what medications they give, or what kind of treatment they give the patient. I need to change the mannequin's OBS or vital signs to reflect that.
So guys, we got a pulse, but he's not breathing by himself, so I'm just going to keep on bagging in.
With the condition of the patient stabilised, Ella winds up the session.
Right, okay, perfect. Yeah, theatre aware, with my pan scan him first on the way up, we'll get ortho involved as well. Okay. Great, thanks guys.
Perfect, thank you.
Right.
Now it's time for the team to evaluate the simulation.
We do a really detailed debrief, so that means we sit down afterwards, ask everyone how they felt during the scenario, and we kind of go through learning points.
We got through all the steps pretty well, so from that point of view I think we did really well. Well done, team.
It's really important psychologically that people feel safe doing simulation, because if you don't, you won't do it again because you feel like people might be making fun of you, or that you don't feel comfortable making mistakes, and that it's a test, whereas it's not. It's supposed to be somewhere where everyone can learn safely and make mistakes, and then we discuss it afterwards and talk about all the things we can do next time and learn from there.
This is an incredible learning resource and methodology for students and for the hospital. It is the power of it where you can train undergraduates and postgraduates and everybody together, and they can see each other training and continuing to learn. I think it's so important for students to see that once they qualify, it's lifelong learning. We're always improving. Things always happen in healthcare that we need to address.
So we're just doing some investigation. Once I think I finish medical school, I would love to continue with the simulations. I think as a working professional, there will always be room to grow and room to understand. And if I'm working with my future colleagues, I think it'll let us work in a situation that we might face in a real life setting. However, doing it in a safe, simulated environment allows us to work through any challenges we may have.